A lot of confusion after the Trump administration changed the way that COVID-19 data is collected nationwide. Some say it's part of a bigger fight between politics and science. ABC 10 News anchor Derek Stahl goes in depth to explain what the change means for local hospitals.
Since March, hospitals have sent information on their COVID tests and available bed space to the CDC, and the CDC has posted that information online. But as of Wednesday, hospitals were directed to send that information to a different database, and the CDC updates disappeared.
The new database is run by a private technology firm called TeleTracking Technologies. It's now collecting everything from the number of ventilators and PPE to the availability of certain drugs.
The intent of this is we need to make sure that there is daily data that is being given to Dr. Birx and others who are running point on a lot of our actions with remdesivir and identifying hotspots.
The White House says the old CDC-run system, the National Healthcare Safety Network, was only capturing 81% of the nation's hospitals, and the new system will provide a more complete picture. The change comes after the White House sparred with the director of the CDC over school reopening guidelines, but he says he's okay with the new system. However, 4 former directors of the agency have raised concerns.
I see this as a big red flag. CDC has been sidelined throughout the response. They haven't been able to hold press conferences and talk directly to the public on a daily basis.
Dr. Richard Besser says the data should be kept with the nation's top scientists, even though he acknowledges the CDC system had its flaws.
It doesn't make sense, and it concerns me about the influence of politics on what should be good public health science.
The White House insists the CDC will still have access to all the information, as well as the public, although for now, the last public update was on July 14th.
Dr. Redfield confirmed this. No one is taking access or data away from the CDC.
Local hospitals send their data to the feds in different ways. Scripps Health uses an intermediary, the California Health Association, and they say the change has had no effect on what they do. Other hospitals have to manually input their data. Palomar Health and Sharp say they haven't had any trouble with the new system. Derek Stahl, ABC 10 News.
If you have a story that requires an in-depth look, ABC 10 News is listening. Send your ideas to tips@10news.com.